Hello, my name is Addie Flood. I'm one of the nurse practitioners with the Center for Colorectal and Pelvic Reconstruction. I work on the inpatient side, taking care of your child when he or she is admitted to the hospital. I work with other pediatrics nurse practitioners in the hospital as well as the colorectal surgeons, and we work together to take great care of your child. Primarily, I focus on providing you with education about the specific colorectal care needs of your child and what to expect after you go home from the hospital. Cassie, can you tell me a little bit about yourself?
Yes, my name is Cassie DeCarmo, and I am a nurse clinician with the Center for Colorectal and Pelvic Reconstruction, or as we like to call CCPR. I have worked in the outpatient role for 2 years now on 2 different teams, Team Allen, Team Eagle, but recently transitioned to work with Addie as a inpatient educator, kind of nursing standpoint, which has been very fun. So I will be helping Addie with a lot of the after surgical care education and discharge planning for when you guys go home.
Mm-hmm. Additionally, we'll talk about your follow-up plans as well and when you can expect to come back to the hospital and what other kind of testing you will need at that time.
Addie, what is our daily routine like in the hospital?
Well, typically we have rounds every single day. This is when the whole team comes to your child's bedside to talk about how your child is doing and what the plan is for the day. Usually rounds happens first thing in the morning, but occasionally it can happen later on in the day. The team is usually made up of the attending colorectal surgeon, the colorectal fellow, myself, Cassie, other pediatric surgery nurse practitioners, as well as the bedside nurse, charge nurse, pharmacy, stoma nurse, and discharge planning.
And we also have academic rounds every Wednesday at 11:30, where there's a bigger group of us, where we come to your child's bedside, do a little bit more of an educational review on your child's diagnosis and the surgery they had, so that we can educate some more of our staff members.
And throughout the day, several members of your child's care team will continue to check on your child to make sure they are doing well throughout the day. And you can feel free to ask questions at any time during the day when we come to check on your child.
A lot of our families wonder when they will see us during your child's visit. So Addie, when would they see you?
Well, I will be there Monday through Friday, every day on rounds. You may not see the same surgeon on rounds, but I will be there every day. Also, you can expect to see me or Cassie at various times throughout the day to talk about the specific colorectal care needs that your child has and to discuss follow-up plans and discharge education.
And I'll come to rounds almost every day. There may be some days I'm not there, but also helping Addie out with the discharge planning and some education on the floor. Mm-hmm. So when you guys have questions about your hospital stay and your visit, I know that it's really easy to pick up the phone and call your outpatient team and utilize email. But when you're inpatient, we would like those questions to be directed to us. So Addie, can you tell us a little bit about the communication inpatient?
Yes. When your child is admitted to the hospital, the people who are taking care of them in the hospital have the most up-to-date information. So we encourage you to ask questions to your child's care team at that point. I know there's a lot going on when your child's admitted for surgery and you may forget your questions. So we encourage you to write them down. And you may ask us anytime during rounds. That's a great time to ask questions, but also anytime throughout the day. Feel free to grab me or Cassie and we can talk about the specific colorectal care needs and follow-up plans, but you can also communicate with your bedside nurse who can grab one of the other physicians or nurse practitioners and we can address your concerns then.
And our outpatient resources are fantastic. Our email, our phone, my charts, and we know it's very accessible and easy to use. And please continue to use that when you are outside of the hospital or after you're discharged. But utilize your resources while you're inpatient because those are the people that know your child's care the best at that time. So once you go home, what can you expect? What is the follow-up and how does your questions get answered after you're discharged?
We usually like to anticipate what kind of questions that you have after you go home. So we prepare the discharge summary. It's also called AVS or after visit summary. It has all of the care instructions for your child. For immediately post-operatively in the first couple days or weeks after you get home. We would like you to kind of remember your discharge summary and reference it at home. If you can't find the answers to your questions, then we encourage you to then email or CCPR on call or contact your outpatient care team.
Once again, just utilizing those good outpatient resources, the email, my chart, and the phone. For more information about our center, you can visit our website at www.nationwidechildrens.org/CCPR. You can also contact us at 614-722-4086 and utilize our on-call email, which is ccpr-on-call@nationwidechildrens.org.